Okay.
What do you believe sets an excellent Chinese medicine doctor apart from an average one? What advice do you have for young acupuncturists just starting out? Sorry, that was 2 questions again.
So that makes it 5 questions. Okay. uh, so bottom line is, again, it's the heart. It's the heart. If your heart is in making money, maybe. Um, it's not worth it. There are other areas you can go into that's going to make you more money. It's not about money, right? And so it's about the heart. And whose heart? The patient's heart. People don't care how much you know until they know how much you care. And so you do have to care, but you got to have knowledge to back it as well. You have the knowledge and the skill to back the heart. And so you have to care, because once you care, then you become the vessel for the healing. The healing power is already within the patient. When the patient has a cut on the skin, it's going to heal, right? If it's a small cut, it's going to heal. That healing power is already built in from within the body of the patient. Yes, we're here to facilitate. And in that facilitating, you have to care. You have to care. And when you care, trust me, miracle happens. In love, miracle occurs. And so when you're able to be that vessel for love, for the healing, and that's what I always tell patients is, without love, there's no healing. And they know, because when I put a needle and they feel that love, they feel it. They really feel the love. They say, ouch, ouch, that's love. And and after a while, they know that's love. So that healing, it is the love, right? Without love, there's no healing. So that's essential. If you go into the healthcare, you're a healer. And to heal, you gotta have love. And without that love, no healing can happen. You can manage symptoms, like what I used to do in conventional medicine, with managing symptoms. I want to go to the root cause. So you have to care. You have to come from love. And when you do, that's when you're going to see amazing difference. And so when you're studying, and I advise you, if you're still in school, don't study for yourself. Study for your future patients. Study for your future patients. And care for them. And in terms of knowledge, yes, you accumulate over time. So the learning in school, the fundamental learning, the education itself, it gives you a foundation, but a true learning begins at clinical, not in the classroom. Anything you learn in classroom, at best, is imitation. You're imitating what works, right? The 3 levels of learning I talk about. The lowest level is imitation. And when you're in the clinical, you begin to integrate the knowledge that you have from whatever you're learning. So that integration, but take it to the highest level, and that's innovation. So that level of learning, of course, imitation, integration, and innovation. But to get to the highest level of innovation, you have to be able to integrate all the information's out there. And the more information you know, the better, right? There's no one size fits all. You cannot say acupuncture treats everything. It can't. But when do you use acupuncture? How about chiropractic adjustment? Or in Chinese medicine, we call it bone correction. When do we do that? When muscles are too tight, should you do the bone correction? I'm going to say no, because you're fighting with the muscles, right? So you have to make sure the muscles are relaxed. And so it's going through the process of getting to the point to know when to do what. And even when a patient comes to see you, they may be seeing other people already, right? Yeah. And when they're seeing other people, they might be in different stages. You have to know what stage they're in and assess them at that point, and then understand the progression on both ends, right? The worst, and then how they got to that point, and if they're stuck, why they're stuck. And if you have adjustment and muscle is still tight, what's going to happen? It's going to pull it back out. So you adjust it again, and then again, and then again. Oh, you got to relax the muscles. But what's causing the muscle to be tightened, right? Is it because lack of blood flow? Is it because increasing scar tissue, too much scar tissue? Or is it because the body's missing something, right? Electrolyte typically. And you know Charlie, right? The guy with the horse. People give that Charlie horse, well, it's lack of electrolyte. Typically, it's lack of electrolyte. And so it's understand the different components. So you're not just managing the pain. Even if you're really good at managing the pain, you know better than the Tylenol. Does that make sense?
All right. Thank you, Dr. Soul, for your
You're very
answer.
welcome.
Thank you for spending